Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. Hey, so today I want to talk to you guys about what is fibrosis after plastic surgery. Specifically, I want to talk to you guys about the fibrosis parts in our online course. So if you guys are watching this on Instagram, hi. If you're watching it on YouTube, hello. If you are watching it on the course sales page, our online course is built around swelling and fibrosis and preparing you guys for plastic surgery or helping you after plastic surgery. So it's first pre-op, right? Understanding what we need for post-op, but then if you find us post-op, understanding the right moves to make so that you can heal properly. So throughout the entire course, I talk about lymphostatic fibrosis, which is where your lymph fluid, your swelling, gets static and becomes fibrotic. So in our course, I teach you guys how swelling turns into fibrosis, how to stop it from turning into fibrosis, what do you do if it's already turned into fibrosis, and how we get rid of it. And I want to talk to you guys and help you understand a little bit as to why you need the course to learn how to get rid of it. Because a lot of times you guys will research online, right? You'll go down Google rabbit holes, YouTube My Journey videos, Real Self, Instagram, TikTok, Facebook groups, and everyone is saying something different. Fibrosis is a scientific thing. There is nothing different about it from anybody's standpoint. It's science of how it's made, right? So when we're talking about fibrosis, what is it? It's the lumps, it's the bumps, it's the hardness, it's the thickening, it's the stiffness, it's all of that that starts happening after plastic surgery. Fibrosis does not need to happen after plastic surgery. That is not something that is part of the normal healing process. So you stub your toe really bad, you bang your hand or something. You have an injury. But the easiest thing is you stub your toe. It swells really, really bad, and then it goes down after a while, right? That's a small, tiny area. You never get fibrosis from that. You burn your hand, you get a cut, and it heals, and you never get that hardening, thickening. You may, if the skin isn't treated right during the healing process, you may scar, right? And now here's the thing, and I will do another video on this, but scars do not have to be a death sentence. Scars don't have to be dark, they don't have to be lumpy and bumpy, and we don't have to freak out about them being that way because we can prevent it. Here's the thing with all of this. With all these things, fibrosis, scar tissue, all the things, because they're all intertwined into one. They do not need to happen. They are not a normal part of your surgery recovery journey. Just because they are common does not mean they have to happen. It does not mean it's something you have to prepare for and figure out how to get rid of. What you need to do is understand your healing so you can heal properly without having these things happen to you, which is why throughout the entire course, the first four modules, because the fifth one is talking about how to find your lymphatic therapist, what to look for, the training that we get, all of that, to know that they're actually a lymphatic certified therapist and not just a massage therapist rubbing you with oil saying that it's manual lymphatic drainage. But that's module 5. In everything 1 through 4, I mention fibrosis a lot because fibrosis starts as swelling. Fibrosis is an aggravated, inflamed form of swelling. So we got two articles here, right? So Air Sculpt, actually, Elite Body Sculpture, Air Sculpt, they have on their airsculpt.com website, they've got fibrosis after liposuction, causes, symptoms, and treatments. The thing I'm going to pick out of this, the first thing that it says is, generally speaking, fibrosis means the thickening or scarring of tissue. In cosmetic fat removal, fibrosis after liposuction refers to the formation of fibrous tissue in a treated area. Fibrosis happens during the healing process and occurs in response to tissue damage. Okay. Now, another article we have here, Eterna Cosmetic Surgery, and this is coming from like one of the surgeon's website that I found. So instead, if a patient already has developed fibrosis, Dr. Hernandez recommends lymphatic massage as the best choice treatment for the same reason it works so well to prevent the problem from occurring in the first place. Interesting. So preventing the problem from occurring in the first place and fixing it is the same thing. Huh. Okay, so we go about it the same way. Manual lymphatic drainage, lymphatic massage, which this surgeon is telling you. And as AirSculpt says, it's a thickening or scarring of the tissue, right? So when we're talking about fibrosis, or when we're talking about anything with plastic surgery or anything in general, before we figure out how to deal with it, we need to understand what it is we're dealing with and how it got there. Fibrosis is your body having trouble healing. It's fibrous thickening or fibrous tissue, right? Your body's starting to make tissue. It happens during the phases of wound healing, which you will learn in our course. It happens when the proteins in your swelling, all of your swelling, starts to try and make tissue, and it's disorganized tissue. Now, I do have an entire course coming out targeted specifically on fibrosis itself, the science of fibrosis. But in this course, I teach you guys how lymphostatic fibrosis happens, what aggravates it and makes it worse, what do you do if you have the lumps and bumps, how to get rid of them, why manual lymphatic drainage works for this. Because again, it's proteins that lie in your swelling. The way we get the swelling out is through manual lymphatic drainage, as this surgeon says. Your body is meant to absorb the swelling and then you pee it out. There are several reasons your body is having a problem absorbing that fluid. And I list all of them in the course, all those little road bumps, all those things that you guys are doing that's so extra, that's causing swelling to get trapped and not reabsorbed. So like all of the wood therapy, cupping, cavitation, carboxy, all the things that you guys are doing way too soon in your surgery recovery that is causing the swelling to get trapped, causing the proteins to get compacted. So throughout the course, I teach you guys the kind of like the journey that swelling takes as far as when it starts in your body after the cut, after you have your surgery, and then the journey that it's going to go through and what it needs to go through on that journey so that your body can use it to heal properly. And I also talk about in Module 1 how your body uses swelling, what it's there for, like how can we work with it to get it to do its job better. In the healing process, when you guys start doing a bunch of these things or doing too many things or wearing garments that are too tight or all this craziness that you're reading, boards, everything you're reading on the interwebs, your body starts getting hard, your fluid starts getting trapped. This is fibrosis. The actual science of how that happens so that you guys understand it, I go through in the first 3 modules in that initial where I'm teaching you about the lymphatics and teaching you about swelling. But the same way that we're going to get rid of the swelling, like he said, preventing the problem from occurring in the first place, which would be getting rid of the swelling that's excess, that's not needed, that gets the swelling moving so it's not trapped, is the same way we're going to get rid of the fibrosis. And you have to understand, in order to know how to do that, to get rid of it, you have to understand how the body works lymphatically, how the swelling works, how we're supposed to get the swelling out with lymphatic drainage. Because you guys will say, oh yeah, I went to this person, they did this wood therapy, this cupping thing, and it was supposed to get rid of my fibrosis, and it softened for a day, but then I blew up and it got hard the next day, and it didn't work for the fibrosis. Or I'm using a roller, and it feels like it's softening, but I still feel really stiff. Fibrosis is an inflammatory process in the body. It's an exaggerated form, or like an advanced form of the swelling. It's changing consistency into a dense mass, whether that be one lump, two lumps, several lumps, your whole lipo area all over that's starting to get hard. So to understand how to get rid of fibrosis, you need to understand how to get rid of swelling. And that's where the course comes in. And that's why I talk about it, is how to get because swelling is made up of a couple different parts, right? So lymph fluid and swelling is made up of proteins, white blood cells, fats, water, a whole bunch of different things. But what we're talking about here is the proteins. Those proteins, myofibrins, collagens, elastins, all of those proteins are meant to make new tissue. And as AirSculpt says, it's a thickening or scarring of the tissue. It's where the natural healing process that's supposed to be occurring isn't laying down flat. It's starting to congeal and get thick and misconfigure itself in there and be lumpy and bumpy and weird. And it can become permanent scar tissue, right, after a while, because those same proteins that your body is using to try and heal itself permanently is the same proteins that are getting miscombobulated in there, becoming fibrosis. So as we talk about all these different massages that you guys are doing, you're not actually getting your body to process those proteins. You're doing all these different kinds of massages, and you're not dealing with the uptake of proteins to get those things out of you. All you're doing is trying to squish that misconfigured lump and like scrape it and smooth it out. But again, remember that thing was swelling to begin with. So if we're doing that, if we're using rollers and scraping and wood and all of those things, sure, you may get it to flatten out, but you're going to increase the amount of swelling because you're causing damage to an area that already has tissue damage to it. So one, you're not healed, you're causing more inflammation. And we know that fibrosis started because of swelling and inflammation to begin with. So now we're causing even more swelling and inflammation. Give it a day or two, it's going to start to get hard again. And you're going to have this yo-yo effect with your fibrosis. And you're going to go and do all these painful things because you don't understand what the thing is itself. So in the first module, I teach you what swelling is. I talk about lymphostatic fibrosis because we talk about the phases of wound healing and how that happens. Module 2, and again, I talked about this in the last video. If you've watched the full video where I talk about the course that's on this sales page, I'm going to be doing 3 other mini videos on each part that you guys are asking me about. So one is fibrosis, one is the massages, and one is like the post-op supplies that I talk about in the course, like how you can start using those to prepare for surgery. But part of the modules, each part, we talk about lymphostatic fibrosis, and I break it down for you guys because as we go through the swelling journey, I start to explain to you where it goes wrong in module 3. What happens if we don't get the swelling out, where it goes wrong with the swelling. That's where the fibrosis part of it is. And then in module 6, the bonus module, I talk to you guys about how you can mobilize those proteins, not just with manual lymphatic drainage, but at home as well. That's why lipofoams are so important. So I talk to you about how the lipofoams mobilize those proteins to start working that fibrosis, getting it, it's kind of like a giant knot, right? And all of your proteins are healing like this, intertwined. The foams start to help work that proteins back into your body and get them to be nice and calm and float down into where they need to be and heal properly. Same thing with manual lymphatic drainage, is because it's getting your body to absorb that parts of that excess jumble of the knot, absorb pieces of the strings so that it can start to lay down flat, so that the excess that's not needed goes out of your body and whatever's left makes that flat, perfect, smooth tissue. That's why Dr. Hernandez is saying manual lymphatic drainage helps get rid of fibrosis the same way it stops it from occurring in the first place, because it's all the same thing. Fibrosis is an inflammatory process. It's just swelling that got stuck in a corner and like smushed and pushed and beat down and conjumbled and knotted up and is stuck there. It's stuck fluid. So if you're looking to figure out how to get rid of your fibrosis, you need to understand what manual lymphatic drainage is, how the lymphatic system works, and how swelling works in the body, which is what I teach you in the course. Once you understand all of that, you then know how to get rid of your fibrosis. I also talk about things that make swelling worse, which will obviously make fibrosis worse, because fibrosis is aggravated swelling. So things that you're doing that are making your swelling worse, which will make your fibrosis worse and stop it from dissipating. Things that are trapping it, like garments that are too tight. Things like all of those other kinds of massages that you don't need until 3 months out, that are all contributing to the inflammatory process. I cover all of that. So you guys can kind of pinpoint where in your recovery plan, in what you're doing, where are the things that are causing those proteins to get congealed and that swelling to get congealed and thick, building up into fibrotic masses, and then eventually healing into tissue. And I talk about, when does fibrosis become permanent? When does that tissue become permanent? We go over the phases of wound healing, and I talk about when swelling gets trapped and stuck in the body. Same thing with fibrosis. Your body can heal and you can still have swelling. Your body can heal and you can have fibrosis. The difference is swelling is going to come off of you when we do manual lymphatic drainage a year and a half later. Fibrosis is those proteins, and their job is to make that tissue. So once we go through proliferation and remodeling, now it's permanent tissue. So at any point up to about a year in your healing process, if you take this course and you understand, oh, this is what my body's going through, this is what I was doing to interfere with it, this is what caused those proteins to get all confuddled and knotted up in a corner and compacted and condensed, oh, okay, this is how the body's supposed to work lymphatically to get rid of swelling. Oh, okay, this is how the proteins get absorbed. Oh, okay, this is what manual lymphatic drainage is. You guys can now take care of your fibrosis and set up your own protocol for getting rid of it, because you now understand how it got there in the first place. And that's the most valuable thing about this course, is understanding the process that your body's going through, is understanding when things are happening and how to support your body when things are happening and not get in the way. Because a lot of times we're getting in the way. We're using boards, we're doing aggressive things, we're trapping the fluid, and all of that's a problem. Now, second side to that, you cannot get rid of your fibrosis if you do not understand what manual lymphatic drainage is. Fibrosis is a lymphatic condition. Really quick, I want to explain this to you guys. Now, also, fibrosis is not exclusive to liposuction. You will have fibrosis potential for fibrosis anywhere that you have swelling. Not just from surgery. Surgery, yes, the swelling is obvious, right? We're going to have swelling. It's surgery. We got an injury, we're going to have swelling. There is lymphedema, which is where you always have swelling present. And those guys fight with fibrosis their whole lives as far as keeping it soft, keeping those proteins eliminated out of the body. You can get fibrosis if you've had cardiac edema, or edema after a heart attack, where you have a heart attack or a kidney failure and your legs blow up and you have all this fluid in there and it's becoming stagnant and static and it starts to thicken and become fibrotic. It's not just exclusive to plastic surgery. And that's the other point of this course, is that when you guys understand the lymphatic system and how swelling works and how this whole process works as far as the phases your body's going to go through with healing and what's supposed to happen at each phase with your swelling, you're going to understand, first of all, pre-op, you're going to be ahead of the game, because you're going to know, okay, if I condense these things, if I compress these things, if I do these things, the proteins are going to build up, the swelling is going to build up. The most important thing is to keep my fluid in my body moving, to not let that fluid get stagnant. How do I do that? Manual lymphatic drainage and a bunch of other things that we talk about. But manual lymphatic drainage, obviously. Back to my original point, manual lymphatic drainage is used for everyone and anyone who has chronic inflammation, because my rheumatoid arthritis patients get fibrosis. My patients or clients who don't really have lymphedema or a chronic swelling condition but have inflammation present all the time, fibromyalgia, regular, swelling of the ankles 24/7 where your ankles are always swollen. Some of the diabetes patients that I see, my clients, they have the same issue where their swelling is swelling and it's starting to make their skin really thick and tough and hard. And with you guys with plastic surgery, they come to me for manual lymphatic drainage because they know what it is. They're not out here thinking manual lymphatic drainage is squeeze massage. They're not out here thinking manual lymphatic drainage is using a roller or oil or rubbing or machines, cavitation or like light, fluffy, like this type of thing. They know what manual lymphatic drainage is for and supposed to be, because they didn't go down Google and hear all this misinformation. They went right to the medical journals. They went right to the science. They went right to me. But you guys, when you're looking for plastic surgery and you're seeing post-op massage, you're seeing all this stuff and you don't know what to believe. This is a science. So manual lymphatic drainage is a scientific modality. So learning, like I said in my previous video before this one, learning how the technique works, what the therapist should be doing in the room in order to make the sequence work. I'm going to whip this thing out every video. This map, learning how to work your lymphatic system in the right direction, in the right way, with the right strokes to actually get your body to reabsorb and not just push your skin around all willy-nilly. There is a sequence, there is a science, and learning how to find a therapist that understands that science and that sequence is gonna be your key to getting rid of the fibrosis. Because I talk about the two different types of certifications to know if your therapist isn't just weekend trained, but actually manual lymphatic drainage certified, knowing the anatomy, knowing this map, knowing the strokes, knowing all of the science. And if you are going to someone that isn't following the map, that isn't opening your lymph nodes first to get your body to reabsorb, doesn't really understand how the protein part of your healing works, right? And that's what's causing the fibrosis. If you're not going to someone who's certified in the actual medical modality part of it, they're not going to be able to explain to you how fibrosis works. They're not going to explain to you how, they're going to say, oh, we just have to get it out. It's an adhesion. We just have to rub it out. We just got to flatten it. We just got to compress it. Overcompression is the worst thing you can do for fibrosis because those little proteins and that fluid is already compressed. We want to get it moving. We don't want to compress it more. There are certain ways that we do that. There are certain things that we use. All of that I'm going to talk about in the fibrosis course. But when you're talking about what is fibrosis after plastic surgery, it's swelling. It is an aggravated form of swelling. It is a compressed form of swelling. It's a stuck form of swelling. When you're talking about how to get rid of fibrosis, how to start working on it, you need to get your swelling mobilized. When you're talking about how to mobilize your swelling to get the fibrosis down, you need to understand how the lymphatic system and swelling works with your body after plastic surgery. When learning that, you will learn how manual lymphatic drainage works because we are manually dilating and stimulating the lymph vessels to get them to do their normal job of absorbing the fluid to drain it out through your urine. We are manually, lymphatically stimulating the body to get it to drain the swelling out through your urine. That is how it works. That is manual lymphatic drainage. To understand how the technique works, how the hands are supposed to go, how the sequence is supposed to go, what your therapist is supposed to be doing in the room with you, what's supposed to happen during your massages, how many you would need, because how many you would need for either fibrosis or swelling is not a set number. It's not a prescription. It's not, okay, you had Lipo 360 done, you were at this BMI, you had this many liters taken out, you need this many massages. No, because if you have fibrosis, you're going to need more. But how do you know how many more you need? Well, you won't know unless you understand how your fibrosis got there, how much swelling you have, how mobile your skin is, how mobile your tissue is, how mobile your swelling is. If I do cover a little bit about diet, like things you should be eating, things you should be eating. If you are adding to that swelling, aggravating it even more, if you are drinking enough water to make sure that you're peeing this out, because if you're not, you're going to need a lot more massages. If you're not doing those things already, if you're not understanding the things that are causing vasodilation, which I explained to you in the course, the things that are causing more fluid to rush into your tissue, that is causing that fibrosis to aggravate, and you keep doing those things and eating those things and not drinking enough water, you're then going to need more massages. So in the course, I go over, well, how many do we need, right? How frequently should we go? It's not a prescribed number, and this is where you guys get frustrated with fibrosis and with your massages, is that there is no like set number, right? Obviously, you could come into the office and see me, and I would tell you, okay, give me 2 to 3 sessions. Let me see how this is progressing as far as how it's responding and how you're doing the things you need to do at home to be able to tell you how long it's going to take for this to get rid of itself. Because that's what it is. I'm not getting rid of it. You're not getting rid of it. Your lymphatic system is getting rid of that fibrosis. It's getting rid of it itself. It's doing its natural job of getting rid of the excess proteins the way it's supposed to. So let's see how long this takes to resolve itself with all the help that it's getting from us. right? So I could work on you till the cows come home. I could do lymphatic drainage till the cows come home. If you don't have the knowledge to understand what's going on in your body and how to stop the thing that's causing the aggravated inflammation form of the swelling, which is now fibrosis, if you don't understand vasodilation, if you don't understand garments, if you don't understand your massages, if you don't understand how swelling works, how the phases of wound healing work after surgery or any of that, you're going to get a million massages and none of them are going to work because you are continuing to cause inflammatory processes and condensing processes to keep creating that fibrosis. The key to getting rid of fibrosis after plastic surgery is understanding that it is inflammatory, that it is swelling, and understanding how to get rid of your swelling, not the fibrosis. The fibrosis is let's say like a symptom of your prolonged stagnant swelling. It's not getting rid of the fibrosis. It's getting rid of the swelling that matters, which is again why this surgeon says, Dr. Hernandez says manual lymphatic drainage is the best choice treatment for the same reason that it works to prevent it is the reason that it works to get rid of it. Because it has nothing to do with the fibrosis itself. It is not full scar tissue until you are about 6 to 8 to 12 months out if you leave it there. If you leave it there up to that year mark, up to that 6 months mark, it can become permanent. Until that 6 month mark, which is why I tell you guys, do not do any forms of massage other than the gentle hands only manual lymphatic drainage to dilate your lymph nodes and get your body to pee the swelling out by a certified person. Don't do anything except that kind of massage from a certified therapist that understands how swelling works in the body. Because if you still have a form of swelling, like even a little bit, and you start using cavitation machines and cupping and pressing on it and aggressive rubbing and squeezing yourself into a garment that's 10 sizes too tight, that swelling will turn into fibrosis because we're aggravating the swelling. Things that are aggravating the swelling will cause fibrosis. So I break it down for you a lot more simple in the course as far as like, do this, don't do this. This causes fibrosis, this doesn't. Do this, don't do this. But this is just explaining to you guys like how to even start taking care of this problem, because that's what it is. You guys don't know where to start. You don't have the education. You don't understand how it works. You don't know how this works. You don't know how swelling works in the body. To understand fibrosis and get rid of fibrosis, you need to work on your swelling. You need to understand how to do that. You need to understand what works and what doesn't, and you have to understand the processes your body's going through and what you need when to take care of that swelling. So that is my little quick tip there. But guys, fibrosis is not a death sentence. I'm just going to talk now. I'm done educating. Fibrosis is not a death sentence. You can get rid of it. People with lymphedema get rid of it all the time. If it is prolonged and becomes permanent tissue, that's a different story. But if you're finding me 3 months out, if you're finding me a week out, 2 weeks out after surgery, if you're finding me pre-op, guys, you don't ever have to have fibrosis. You don't ever have to get fibrosis. There is a video on my YouTube channel with one of my clients where she, at the end of the video, we talk about it. I asked her and I was like, and what about fibrosis? And she was like, what is that? And I was like, oh yeah, okay, great answer, thanks. Because she never had it. Because we took care of her swelling to begin with, it never turned into fibrosis. You guys don't walk out of surgery and get fibrosis. Maybe day 3 or day 4 you do. You can start developing fibrosis at day 3 or 4. Because again, anytime there is swelling present at any point in the healing process, it can get thick, congealed, hard, stuck, smashed down, balled up, and be fibrotic and hard. At any point in the healing process, anywhere from the minute swelling is present all the way up until it becomes permanent, a year plus, right? But anywhere in between there, it's not true scar tissue yet until your body enters those last 2 phases of wound healing, which you will learn about in the course. But it's not a death sentence. Just like, yes, it is something you need to be aware of because it can permanently jeopardize your results, but it's not something that we need to be so like over analyzing as far as going down the rabbit hole and trying all these crazy things that are painful, that are hurting your body. You guys I don't want you to be so desperate about your fibrosis anymore. That's the problem, is you get scared. You get scared because you watch these My Journey videos, you watch the YouTube, you watch the TikTok, you look on the Real Self. People are like, oh yeah, I had to go get it injected with carboxy and it got softer, but it's still hard. And now I have these lumps and bumps everywhere. Yes, but again, that person did not go to a swelling specialist like me. That person didn't take a course like I just created for you guys to understand any of it. They just started throwing shit at the wall, hoping that it sticks, rather than trying to understand it, which is why I talk so much about it in this course, because you can't talk about fibrosis without talking about swelling. There's no way, because it comes from swelling. It is swelling. And you guys panic because you think it's some like random crazy thing that's happening to your body. Now, I understand it is super painful, and it can be because it's an inflammatory process. It's gonna bind you up. It's gonna hurt. Like I said, facelift. You can get fibrosis from a facelift. You can get cording, where you can't move your neck, where you can't open your jaw, because swelling that was here due to a garment that was too tight binded up into one thick brick across you, and now you can't move. I have a video of a client who had chin lipo where that was her exact experience, and we got rid of her fibrosis. She tried every single other kind of massage, including someone who said they were lymphatic certified and rubbed her with oil. But she did admit to me she didn't understand the credentials. She didn't know what letters to look for. She just looked for any certificate. Guys, anybody can take an online course and get a certificate. The courses that we take to become MLDCs and CLTs, you have to have a massage license to take, and it has to be in person. Sure, it might be online home study and in person, but it's either 40 or 45 or 135 hours or more in class to be able to do this, to understand this. So when you're looking for certifications and you're saying you went to somebody for lymphatic massage and it didn't work, or they couldn't explain anything to you, it's because they didn't have the right certification, because you looked for a certification, not the certification, which is what I teach you guys. And then I give you questions on like what to ask your therapist to make sure they actually know what they're talking about, and you can have a conversation with them and ask them questions and get their help as far as the swelling. So that is in there as well. But you guys get so scared because it is so painful. And then once the pain subsides, after that like initial inflammatory phase of the fibrosis, it just gets hard and cold and stiff and lumpy and bumpy and weird, and it starts to dimple and wrinkle your skin. And again, it can happen after any plastic surgery. This is not exclusive to liposuction. Any surgery that you have swelling, anything, you have a potential for fibrosis. Guys, the reason I keep saying potential is because it's not guaranteed, and you can prevent it. It doesn't need to happen. It doesn't need to happen. It is not something you have to like prepare and put on battle armor for. It doesn't need to happen, but you have a potential for it. So until we get all that swelling out, it is something you need to be careful of. It's not something you need to like look for and be like, oh my God, it's starting. It doesn't ever have to start. And you guys get scared and you start looking for anything and everything. And the minute someone says something worked for this thing, you jump at it and you do it. And you put yourself through pain and torture and confusion and, oh my God, is this getting better? I don't know. I did this massage, but I don't know. Is this getting better? Does it look better? I don't know. It feels better. And then the next morning you're like, shit, it's back. Oh no, it looks worse. Oh no. Oh no. And then we start panicking. And then we have a spiral. And then you find me. And then I have to educate you on the science of it and how it works. So this is what the entire course is for. Guys, stop the spiral before it starts. You are scared and you are spiraling because you have no actually backed information. I have 2 MLDC certificates, a CLT certificate, 3 advanced MLD plastic surgery certificates, and these are all from reputable schools. All of these things are on my website. I have 4 certified compression garment fitter for medical grade compression from the 4 biggest companies in the nation that deal with lymphedema, which is a chronic swelling condition, who also makes products and garments and educates people on fibrosis as well. There are people with lymphedema that have to wear overnight garments with the same Amare polyurethane foam. It's not the Amare brand, but it's the same medical grade polyurethane foam that I created for you guys after plastic surgery, that they have to wear overnight to make sure their fluid does not become stagnant, thick, fibrotic. And if it is becoming stagnant, thick, fibrotic, that overnight garment will help soften and mobilize all of that fluid. So when they do their MLD, so when they go get their sessions done, so when they're wearing their regular day garments, that all of that is moving and mobile and not building up and becoming stagnant. I talked to you guys about the foams in the course and why it's important. I talked to you guys about the foams in almost every video. But understanding why they work for your swelling is what's going to make them work for your fibrosis. The foams prevent fibrosis because it mobilizes the proteins and your swelling. The foams get rid of fibrosis because it mobilizes proteins and your swelling so that your body can start reabsorbing them. Do we catch, and I've said it a million times, do we catch the whole theme here? It's not about the fibrosis, guys. It's about the swelling. Just because you are not squishy, and I talk about this a lot in the course, especially in like module 3 and 4, just because your swelling is not like first day surgery swelling, or like you stub your toe, or you have a blister swelling where it's soft and squishy and watery, does not mean that it's not swollen. Just because it's hard does not mean that it's not swollen. Just because you have that softness on top doesn't mean you don't have fibrosis underneath. You guys can feel it. You guys tell me that you have fibrosis underneath. You're like, well, my surgeon said it looked good and it's soft here, but when I move and when I breathe, it hurts and I can't move and I can't breathe and I'm stiff. That's fibrosis with swelling on top of it because the bottom layer became fibrotic and the top layer hasn't gotten there yet. And that fibrosis bottom layer and top layer of swelling, that's all just swelling. It all just comes down to it being swelling. Your entire recovery, you should be a waterbed. You should be soft and squishy because that's what's going to help your MLD therapist get that out of you as much as possible and maximize your sessions. The softer and squishier you are, the better of a recovery you're having. Fibrosis is not something that has to happen. Fibrosis is not something that you need to gear up for war. Fibrosis is not something that if you have, isn't a death sentence. Like, this is never going to end. It's never going to stop. Oh my God. Well, it won't if you don't take care of the swelling, if you're not addressing the lymphatics, because that's where it starts. And that's the theme here, guys. So what is fibrosis after Let's wrap it up. So in our course, we teach you about how fibrosis starts, what lymphostatic fibrosis is, what causes lymphostatic fibrosis, what aggravates it and makes it worse, what you can do to stop aggravating it, what you can do to start getting it to soften so your body can reabsorb it, how to turn it back to its original form, which is swelling, and most importantly with this course, how to get your swelling out, that excess swelling, how to get rid of it so your body can heal properly, what to expect from your swelling, how to know when you're getting better, how to know what you need at what point in your healing, how to find your lymphatic therapist so that they can help you get that excess swelling out, the role of your garment, how your garment works for your lymphatic system to help keep that swelling from becoming stagnant. Sometimes if you're in a garment that's too tight, it can cause it to be static and cause fibrosis, which I talk about. But the role that garments play in helping with your healing as far as making sure that your tissue is supported so it doesn't, 1, gain excess fluid, and 2, that fluid doesn't become stagnant and fibrotic. What supplies are causing more swelling, which will then cause fibrosis, and what supplies are helping get rid of your fibrosis and mobilize your swelling and mobilize your fluid, which then means getting rid of your fibrosis. Fibrosis is kind of like it's kind of like an afterthought. It's kind of like a side effect of the swelling, good or bad. So your fibrosis is coming down. It's a side effect of you helping your body process the swelling out. Your fibrosis is getting worse. It's a side effect of you neglecting your lymphatic system and neglecting your post-op care and neglecting all of your like aftercare things that your body needs to help it heal properly. So I go over all of that with you guys throughout the entire course is littered with it. Every single module I cover another piece of it and paint the picture for you guys, because it's so important, because it is swelling, and it's swelling that is just aggravated and annoyed. And there's no reason for it to get to that point if you only understood how to take care of your swelling in the first place. And I say take care of and not get rid of, because swelling serves a purpose for healing. Those proteins serve a purpose for healing. It's when we're neglecting our healing that the problem comes in and it gets pissed off and becomes fibrotic. And now it's like, all right, well, I mean, if I'm just going to sit here in your tissue, I'm just going to sit here forever. And then I'm going to create a permanent parking spot for myself right here where you put me, and I'm going to become permanent tissue. It doesn't need to be like that. We can get it up and moving. So we go over all of that, and that is one of the major like things that you guys need to understand, because it goes through every single phase of swelling. Fibrosis goes through all of it as far as your wound healing. It can happen at any point and every point. So there is no one direct answer. But the course goes through everything that you would need to know if you've already had fibrosis build up and you're trying to get rid of it, or if you're preparing for surgery and you're trying to make sure that you're aware. I don't need you to panic. I don't need you to prepare. I don't need you to gear up for battle. I need you to understand and be aware of what's happening and when, so you can communicate with your therapist so that you guys can be on the same team and you can help either heal it, reverse it, get rid of it, or you can make sure that you're preventing it and check in on your healing and know what's going on and be informed. Because a lot of times surgeons will scare you with the fibrosis thing, and they'll be like, oh, it's fine, wait till 6 months, we'll see. Okay, but at 6 months, your body's already trying to make it into permanent tissue, and you're still lumpy and bumpy, and you're like, dude, WTF, I want this out of me, I shouldn't look like this. And then at 6 months, they're like, all right, we'll give it a year and then we could do a revision. And you're like, what the... That's not an answer. And you guys feel helpless and hopeless because you're diving down these people's My Journey things, and their boards and rollers and ice and heat and machines and rubbing, and all of that is making it worse for you. Because for them, they don't care. They're doing all of this and it looks flatter, so they're good. But you don't know how it feels. Right? It's not dissipating. It's not softening. It's just shrinking. It's just looking flatter, because we took something that looked like this and we smushed it into something that looks like this. All of this here in the middle still here, guys. It's not this, and it's definitely not this. It's this, where it's all knotted and crazy, but it looks flat, so we're okay. It's just lack of information. That's all it is, guys. So biggest thing, if you are trying to understand what fibrosis is, if you are trying to prevent it from happening, if you have it and you're trying to get rid of it, take our course. It covers everything, because again, fibrosis is just an aggravated form of swelling, and you need to address that first, and the fibrosis will resolve itself. You don't need to do all this extra stuff. Your body will take care of it if you work with your body and not against it. So guys, that's all I have to say. Our course is on our link in bio. You can purchase it there. It's on our Amare post-op shop. We do have payment plans. It's amarepostopshop.com, and it's right there, the first thing right before the products on our post-op shop. It's the link in our bio on our Instagram, and I will have it linked in this YouTube video as well. But if you are trying to get rid of fibrosis, you're going to be fighting a losing battle and an uphill battle if you don't understand how swelling works, and if you don't understand how it got there to begin with, because you may be doing your massages with your lymphatic therapist and continuing to create the same problem, and it won't be getting anywhere, and you're going to get frustrated. So guys, Ashley with Amare. You can purchase the course now at the Post-Op Academy, or just amarepostopacademy.com. And that's it, guys. I will hope to see you guys soon. And that the fibrosis course specifically, this course is post-op massage, lymphatic massage, and finding a therapist. Post-op lymphatic massage and finding a therapist. The fibrosis course specifically is going to come out within the next 6 to 8 months. It's going to be a mini course. We're not going in depth on the lymphatic system the way we are in this course. So this is more geared towards like the whole picture of all the things that you're going to be doing wrong after surgery and all the things that you need to be doing after surgery. And your massages is one of those things, and clearing up the whole, what the heck is this whole manual lymphatic drainage thing? Why did I get 7 different ones and everyone's doing them differently? And I don't even understand how this is supposed to work. And I still have swelling. WTF. This whole course clears that up and teaches you about it and teaches you about fibrosis as well. But as far as the science, like, I'm going to link medical journals and like paint the full picture, deep dive on fibrosis for you guys, as far as the science of it, how it's created in the body, the process of it, what's going on, the phases of wound healing, again, all of that specific to the science of fibrosis. That's going to be in the next 6 to 8 months. But you guys don't need that to start getting rid of it, because it's just swelling. And this course is designed for that, is to teach you guys how to work with that, to start resolving it. So that'll be later. Keep an eye out for that. And I'll do, of course, videos on that as well, and let you guys know when it's out. But right now, you can go and get our post-op lymphatic massage and finding a therapist course and start getting rid of your fibrosis, guys. Or start at least educating yourself to prepare to prevent it. The same amount of work it's going to take to get rid of it is the same amount of work it's going to take to prevent it. It's the same work. It's no different. You don't have to do anything fancy or anything extra. You really don't. It's the same foams. It's the same post-op cream, our foams and our post-op cream. It's the same thing with your garments. It's the same thing with your massages. Whether you're on the preventing side of it, where you're working to prevent it or working to get rid of it, it's the same thing. Literally, you're doing the same work. So whether you have it or you're trying because you're scared, because you've heard all this craziness, which you have a right to be, it can become permanent. You have a right to feel upset and scared about it. But getting an understanding of why you shouldn't be afraid of it, because you have the power to prevent it and get rid of it, and it's the same things you're going to be doing for both. That's where this comes in. So, guys, I hope to see you in that course soon. I hope to see you anywhere soon. Ashley with Amare. I will talk to you guys later. Bye.